Awesome. This is wow.
Whoa,
In fact, whoa. All those slides coming at me fat. Look out. Look out.
just a
Oh my
taste of what you're going to
goodness.
see.
What just happened? So that was a neurological test for you. Anybody remember what they saw? Let's go back through that. Can anybody tell me what they no. No, what a great topic. I mean, it's about time we have a good topic like this. Carissa, nothing against your topics, but now we're into some, no, I'm just teasing. No, this is awesome. We're going to talk about chiropractic and the neurology behind it. We're coming off of a seminar that we just did this past weekend. Uh, uh, it's called Y Files. It's a neurology seminar along with nutrition and everything, and how everything, any simple stress response that your body's going through creates a change in your physiology and your adaptive physiology. All disease processes, gentlemen, didn't we find out,
Yep.
usually come back to some sort of physiological stress response. So, how important is us dealing with that stress response? And let's take it one step further. Any joint not moving through its full range of motion, is that a stress on us? Claire, if you can't run and feel great when you're out running, is that a stress for you? Oh, she's muted. Sorry. She says yes. Okay. Yeah. She's signing yes. All right. So, but that's so true, right? If we can't do the things that we enjoy, chiropractic is a tool to help us figure out, and the total body assessment, figure out where we're not moving well so that we can improve those functions and then we can thrive in our environment. So, Sam, Travis, I might throw in a little bit. I'm going to turn it over to who's first? Who's going to start this thing off?
You want me to start first then?
Yeah,
Oh
that's
my,
fine.
here we go.
Okay.
Balls in the air. Here we
We're
go.
we're
Travis.
gonna we're gonna kind of
We're gonna
piggyback
tag
off
team
each
this
other.
thing anyways, so we're good.
All right.
Yeah,
Awesome. All
we're
righty.
gonna
Let's see what we
piggyback off
got.
each other. So whatever Travis doesn't hit on or whatever I don't hit on, we know what to say. So
Yep. Awesome. Awesome. Let's go ahead. Let's get this rocking.
All right. So we know a lot of people are gonna be watching this on the program and things like that. So we just wanted to touch on kind of what people coming in who haven't been adjusted think chiropractic is. So they think it's like only back pain, neck pain, like pain management, only come when you hurt. We're going to go into this. Sam's going to go into this on the next slide, but we all know that's not the case. And then a lot of people are scared to get adjusted. They think like bones are popping or breaking or forceful adjustments. And a lot of times, especially in our practice, we're not very aggressive at first. We'll hear a few pops and clicks. It's actually a gas just dissipating out of a joint. And then people are concerned about, long-term plans. It's expensive, insurance only. Well, if you come when you're healthy or being proactive, guess what? Those care plans, one, aren't going to be as long, two, not as expensive, and you guys are paying for, deductibles for insurance and like surgeries and things like that. So,
Oh, I could barely hear you, Trav. Something happened with your sound.
hear me now?
Yeah, there you go. Good. Yeah.
Yeah, so like with insurance and being expensive, like people are so quick to get a surgery or something like that, where that's actually more expensive than, coming in for a plan with us here at the office or any other chiropractic office for that matter. So,
Totally agree. In fact, right, they come in and one of the things that they say is that, you know what, does my insurance is free or my
mhm.
insurance will cover it, so it's free. When you're like, guys,
You're still
it's
paying.
not free. Have you been paying your insurance premiums every month for years? Right. And then at some point, they're only going to pay 80% and you got to pay 20% after you've met a full deductible that may be thousands of dollars. So I agree, Travis. And it's always, but we have been trained to only go to the doctor when we have a,
Problem.
problem.
yeah,
Yep.
yeah. And it's just, and the people that we get to take care of, we're so tickled to have a great clientele and a great tribe because the people get it and they understand it. We always tell them once we teach you what chiropractic can do, you can't unlearn it, right, guys? And that's the
Correct.
brilliance of when you do a total body assessment and show them functional change. It's always going to improve every time they walk out. Excellent job. Yep.
Yeah. And a lot of people too, I think, with like what they think of chiropractic, if they've been to previous chiropractors, they've probably heard the term subluxation or the philosophy of what, traditional chiropractic looked like. And I know we hit on it here in the office, but like you said, Doc, that's not our focus, right? If we can
Right.
show change and
Yeah.
show how, the functional aspect of it, and not just I hurt here, so let me focus here. That's where I feel like patients really start to get it, and they realize the value of coming and not just when they hurt.
Yeah. Yeah. And it's just now, you even said at the beginning of the first slide, chiropractic and neurology. That's literally what we're working on. It's not
Mhm.
just where the pain is. It's up here, guys. We got to work on the brain and the function of that.
Mhm.
Let's see this next slide. I'm excited. Let's get
Which
into it.
goes into the next slide of what chiropractic actually is the upregulation of the brain or of the central nervous system. So we'll dive deeper into a lot of like some like right brain, left brain stuff and in the cerebellum and things like that later on in the presentation. But here in the office, right, the big thing that we want to focus on is how are we driving the brain? And the brain loves movement, right? If all we do is focus on pain, right? Pain can be important to realize, hey, we're reducing the symptoms, but when pain's gone, what are we measuring?
Mm.
Right? What do we see? So that's where it's function, focused and not pain based. Um,
And I was going to say, and at the seminar this past weekend, we learned that pain is the last thing to show up and the
yep.
first thing to go away usually. So just because it goes away does not mean you are well.
Yep.
Yeah.
And that also means we're not just adjusting or addressing the spine, right? The spine's the anchor to the rest of the body. However, the extremities are just as important. So it's whole body adjusting here, right?
Yeah. Yeah.
We'll talk a little bit about it later, but why we check the knees, right? One of the coolest things I think in the office is we really the first adjustment in here is the knee,
Yeah.
but we can show how the knee is being affected because of a communication issue in the low back. Um, and then the same thing with like a dynamic movement pattern, that right leg, when you step, that left arm or left shoulder swings. So when we start to pair those movement patterns together, the patients really understand that, holy crap, my right hip that I've been struggling with, I also have a left shoulder issue. And
Right.
then you're able to show them the change, and by adjusting one, you can improve the other.
Yeah. Totally agree.
Or, addressing those dynamic movement patterns, but also, big thing, if you've been in the office, you've seen the hallway of supplements, right? And we do so much with nutrition, we do so much with stress management that I think that is what rounds out
Yeah.
here chiropractic in general. It's not, you go to most chiropractors and they only adjust, or they adjust and they do some modalities. They mention some nutrition, like you probably cut out some sugar or things like that. But most of the time in here, it's how are we addressing the whole system? And yes, it starts with the chiropractic, but it's also incorporating nutrition and stress management.
Love it. Love it. That's exactly right.
Anything you want to add, Trav?
Uh, no, the only thing I want to add is with the nutrition part too. We talk, or the stress part is where it's not just physical stress. It's not just the trauma or an injury. It's the toxins in the environment, or just even our thoughts as well. So
Yeah.
the three T's, right? Toxins, traumas, and thoughts. So all of those contribute to not only physical stress, but the mental stress as well. And this is where the brain and the body go together and have to adapt.
Yeah. And I'll tell you what, and I totally agree. And Carissa, how about this? How about having that biblical mindset? We're talking about thoughts and grounded and understanding what we're doing and why we're here. Like some of the monetary or the other things that are stressful on our minds mean nothing to us in God's eyes.
Yeah.
Chris, you want to add anything about that idea? Like even talking about that thought idea and that mindset of really being grounded and centered with that biblical mindset. Would you agree with that,
Yeah,
Chris?
absolutely. Rebuking negative thoughts. They're not from God.
Right. Yeah.
Yeah.
Yeah, exactly. Satan always said, what if, right? That was the what if. God
Mm-hmm.
never, he trusted in what we're doing. So awesome. Sam, keep going. Let's go to the next one.
Yep. Well,
Already
and
gave us a prelude of it.
yeah, the prelude. But the cool thing too, right? Which we learned this weekend is not just adjusting the body, but how we upregulate the brain. So we'll talk about some cerebellar tests, fine motor control, and balance and coordination things that we can help uplift certain parts of the brain, and we'll cover that in a little
Yeah,
bit.
driving that brain. Yep, 100%. Neuroplasticity and developmental stuff. Yeah, go ahead.
So here's some of the neurology kind of behind an adjustment and what's going on. So joints become fixated for a variety of reasons. We talked about stress, trauma, tight musculature, poor movement, and if not addressed, that can lead to a variety of other issues over time. So an adjustment is really just a quick, controlled force to put motion back into a joint. This restores the proper motion and then stimulates like mechanoreceptors, muscle spindles, and Golgi tendons that eventually send input back up to the brain to let it know that it's now moving well, and then it sends information back down. So the brain can now perceive better movement and adapt to better stimuli. So the popping or sudden change of pressure, like we just said before, is the adjustment. It's just a noise. The noise is just a gas dissipating out of the joint. And once this happens, then the surrounding muscles relax, joints move more freely, inflammation can now disperse from the area, and the body can now heal better.
Mm-hmm.
100%, right? You get that movement going. What do you do? What that movement does, it helps to get that fluid that may be stuck in there out,
Yep.
which allows that body to heal better and that whole process to move faster. Because do we really want to suppress the inflammatory response? Is the inflammation a bad thing?
No.
Right? It's the way it heals, right? So it's drawing in nutrients, drawing in the things to help with recovery and rebuilding, and then also getting those things that are damaged or broken down out. Well, movement helps to facilitate that, right?
So
That's when it becomes chronic.
Yep.
Yeah. So I was gonna say, so I guess the big idea with this slide is like through the adjustment, the mechanoreceptors send the signal up to the brain to interpret the new movement. That's where, people get off the table and hear when we do the knee and they're like, wow, that feels different.
Immediately.
Yeah.
Right.
Immediately.
Right. And what's really cool, right?
Quickly.
What we talk about is that's the area we addressed an area of concern, but the brain is what's interpreting what's happening. And the brain is going, wow, that's better versus, man, it's been stuck for blank, however long, right? Yeah. And by the way, how long does that adjustment last?
It lasts for 6 whole days, almost a week.
Mm-hmm.
Yeah. And what we mean by that is that drive or that upregulation in that frontal cortex of our brain is still modeling or remodeling or activating that neuroplasticity of that developmental change for up to 6 days. That's unbelievable.
Yeah,
it's
they
crazy,
said
right?
the PT or a physical therapist treatment is, I think they said what, 3 to 4 days?
No, 3 to 4 hours.
24 hours. Yeah.
Oh,
Yeah,
wow.
yeah. Could be up to 24 hours. But think about it though, and all of them drive some brain change, right? So if you do a study, they did a study where they took manipulations by PT and by chiropractic or whatever modality they were using, they got a change in the frontal cortex, but it wasn't long term.
Yeah.
With the chiropractic adjustment, because of the mobilization and the driving of all the nervous system, you definitely still end up getting that frontal cortex to actually lift into a 6-day change of remodeling in the brain.
Mm-hmm.
Amazing.
Yeah.
Who's next?
I think we're going on the next slide, right? Yeah. There we go.
All right. So here's where we'll really start to kind of dive into the neurology and why it's important, or why chiropractic is important. Not only is chiropractic important, but why it's important to get adjusted. And so we talk about movement in here a lot. So, like Doc said earlier, when a joint isn't moving through its full range of motion or something stopped moving, it's a down regulation or a stress on the rest of the body. So we talk about joints specifically, right? When a joint stops moving, the brain perceives less sensory input. So that reduced movement is going to result in neural atrophy. So that less sensory input results in reduced stimulation to the brain and atrophy in certain neural areas.
What's
Now,
atrophy, by the way?
breakdown.
Break down the tissue.
Yep.
Yep.
Yep. And so this is where neuroplasticity and synaptogenesis, obviously two very big words, can come in, is uh, the brain is able to form new connections, both good and bad, depending on, what's driving it. So neuroplasticity is the brain's ability to change based on new information or stimuli. Mechanical forces like the adjustment or movement into a joint, or like you go into the gym, you work out, you do these things, they help upregulate and drive more input into the brain. However, if we train with poor movement, right, the body gets used to poor movement. And usually the last thing to set in is that pain. And so we have that negative loop where the body can adapt to poor patterns or poor habits or poor movements. The brain ends up building negative neuroplasticity, sort of say. So we want to make sure that by coming into the chiropractor, we put one, better motion and better movement into the joints, but then we're able to train it with that proper movement so we can have that really good neuroplasticity.
Yeah.
Um,
Yeah. And then you even talk about that, like even improved physiological function, because that stress response, we all know that if
yep.
you have a stressor, a joint not moving well, does that affect your digestive system?
Hmm.
Mm-hmm.
Yeah. Could that affect the liver and gallbladder and the heart by golly, all of those things? It's two-way streets.
Yep.
That same nerve system and function going from that organ, which we call visceral somatic or whatever that viscera, the organ, going to muscle or going to the brain, it's a two-way street. So if it's not working harmoniously between the two, that's when you get the breakdown,
Hmm.
especially with that communication problem.
Yeah.
Yeah.
Yep. So we can have, better circulation, better healing, improved overall physiological function. And we've uh, we saw a video actually when we were doing something a couple weeks ago, but it was talking about synaptogenesis and neuroplasticity and how chiropractic isn't just, we're putting motion into a joint. And the video talked about a guy named Norman Deutsch. I think he was an MD, but he's got a book called The Brain's Way of Healing. And in the book, he writes, the brain requires physical movement to generate new brain cells and nerve growth factors. As we become more immobile, we see less, we hear less, and we process less information. So that's just where we're able to see why we adjust the full body,
Yeah.
right?
And think about that though, right? As we age, we move less, right?
Yep.
Mm-hmm.
But what are we telling them, right? We want to move more. And
Mhm.
so why not get adjusted? By the way, when can we start getting adjusted, by the way? Is it only for the old people?
Right when you're born.
That's right. Early, right? So to drive this, but think about it. If we are on the trend that we're on, Sam, you said, Doc, you said it great. If we're on the trend that we're on, we're definitely going to decline, right? We're not going to
Yep.
be, I'm not running marathons later. Claire, you're slowing down, right? Not slowing down with marathons, but still doing activities. Oh, you don't have to make the face. I got you. No, not slowing down like not doing it, but slowing down like not doing as much or as many or as whatever, or not as long, because you still got to get the movement in to stay healthy and strong. But the longevity of it literally takes more stress on the body. Does that make sense? So what we're doing is, if we can do adjusting and get that same drive of the neuroplasticity in the brain, of good movement, healthy feeling, keeping the brain growing and developing, that's where chiropractic comes in. And I think, or we see, that that's the benefit of the adjustment, not just the pain management,
Yeah.
keeping that brain feeling like it's younger than it would be as it gets older. Sorry, Claire, I didn't mean to hurt your feelings there. All right, here we go. Moving on.
All right. So here's some ways to kind of like test some neurological deficits. So posture is a good thing to look at, especially for like the frontal cortex to see which side is kind of dumbed down a little bit. So if you got a head tilt to the right, internally rotated shoulder to the right, foot flare on the same side, that's like inhibition from that right side brain to those muscles, the flexors, to kind of almost get them to contract. So basically, that would tell us from a chiropractic point of view that we would want to adjust the opposite side to influence that part of the brain. And then we've got some different frontal lobe tests like finger tapping, gait with arm swing and dual tasking. So what that means is we'll watch some people walk. Typically, or from class, what I noticed the most was the arm swing, because like some people walk and they don't have an arm swing on one side, and you're like, well, then the frontal cortex is not, working the way it's supposed to.
Activating, right? Yeah,
Yeah,
it's not
activating the
engaging
way
it.
it's
Yep.
supposed to. And then you can even have to challenge them more by having them like count backwards from 50 by 4, or you can, have them name every state, like something that they actually have to think about.
Yeah.
And then you can do like mini mental exams as well. We'll go into saccades a little bit more in a second, and then olfaction, so smell on certain sides, and then like memory tests as well. And then the parietal lobe, more like light touch, vibration, 2-point discrimination. So we put touch at 2 different points on the body. You should be able to tell them a difference until they get very close together. Graphesthesia, so basically with your eyes closed, someone would draw on your hand like a number or a letter or something like that, and you should be able to kind of, based on what they told you, number or letter, be able to tell what it is. Barognosis, so different weights in a hand, you should be able to tell the difference between the weights. And then pursuits, another eye test that we'll get into, and then finger to nose as well.
These are some definitely deeper tests to
Yeah.
give us a little bit more of a sharper look at what's going on in the brain, but more detailed. And then for us then to add to this, this is the neurology that the chiropractic profession's in, and what they keep studying to prove how beneficial our adjustments are. It's just blowing the door off of the ceiling off of chiropractic, and literally what we thought chiropractic was a pain management or a whatever modality that's out there. It's so much more, and it's becoming even more. So look out, even the PTs and all this stuff. You're gonna see this developmental idea of chiropractic. You may not see the same biblical idea of the above, down, inside out and how awesome chiropractic really is, but you're definitely going to see research validating the chiropractic adjustment and how important it is for brain and development. So anyway, next slide.
Yep. So some other ways that we can test neurological deficits. So our cerebellum is responsible for smooth, coordinated movements, posture, balance, but also has that proprioceptive aspect as well. And some of the things that we can test with it are alternating palms up, palms down. So if if one side is lagging or not able to rotate, supinate or pronate as fast as the other side, we can see that there is something going on in the cerebellum, and adjust to upregulate it and then retest. Tandem stance is just kind of testing, in not yes in space, but getting kind of pushed over a little bit. Can the body correct itself, right, to remain balanced? Some other tests in here: heel to shin, knee tapping, patellar reflex. We're looking at hypertonicity, which can cause the leg swing to actually move like a pendulum rather than more dynamic the way it's supposed to. And Travis already hit a little bit on finger to nose, but these are just some basic tests for the cerebellum. And then how we can treat it. Obviously, we can adjust ipsilaterally on that same side, and then do some complex movement exercises where we're using or moving the arm and get adjusted at the same time to help correct that.
Wow, yeah, and I want to just add one more thing to this. That cerebellum. There's one other thing that cerebellum does that we didn't put on this slide. It balances. It says balance, like overall balance. People think that balancing just by standing up. It balances the entire system of the body.
Yep.
It's regulating everything to balance, which we say balance. I would almost use the word homeostasis, which means that is just boom. Everything is doing what it's supposed to. The cells are dying off. They're eating them up. They're cleaning this. They're doing that. Everything is where it's supposed to be versus complete chaos.
Yeah.
Yeah. And that's what we talk about, that finger to nose. If I was touching a finger to a nose and it was chaotic in my cerebellum, you would see me missing
All over the
and not
place.
being able to touch my nose.
Yep.
And that's an extreme case, but these are things that we're seeing and actually they're studying that then validates what an adjustment can do to help with that. In fact, I will post something soon. I think we got to send something, Chris. I want to make sure I post this an MS client of ours, and you can see that cerebellum being not firing like it's supposed to, and then adjusting him and watching him go to try and touch, and his hands bouncing all over. And literally, when we're done, he's right to it. So we'll make sure we post that sometime soon here in our Instagram or our Facebook. So.
Yeah. And then didn't Dr. Longyear mention something about how we only understand like a certain percentage of the cerebellum?
Well, they were saying that 20% we thought that the cerebellum only did proprioceptive movement, and that's only 20%. 80% is literally balancing everything. It's everything else that it does. Yeah, that's what you're saying. Right, Travis? Am I correct on that?
Yeah, I believe so.
Yeah. It was like we thought, but it's only 20% is literally balance. The rest of it is trying to regulate. I mean, it's a large area of the brain. It's right near the spinal cord. It's literally so in tune with all of that proprioceptive input and everything else that's going on that there's a ton of information getting into that brain. And that's where it hits and tries to tell everything what to do. Imagine that in that brain. This is how godly this body is. I mean, are you kidding me? This is why, and I don't want to get into it too much, but you should look at this picture at some point. And we'll go over this one day when we start talking a little bit about biblical. I will bring that up again. But what picture is this, by the way, Carissa?
I can't see your screen.
Oh, sorry. Oh, we can't see my screen?
Now I can see it. Put it up again. Oh.
This is in the Sistine Chapel, developed by Michelangelo.
I lost it.
It's okay. Go back to what you're doing. I'll bring that up. Hey, that's something we should go over though, Chris. So we'll do that in one of our future presentations. But all right, next slide. Go ahead. I'm sorry, guys.
Yep. So we already mentioned a few of these tests, like you saw the saccades and pursuits and like a couple of the other ones. But basically saccades are just an eye test where we have them looking at the person's nose, and people will have their fingers to either side of their head, either horizontally, vertically, or obliquely. And when a finger moves, they have to look quickly at that finger and then back to the nose, and we can see like a jumping of the eyes. So depending on which direction, you can kind of tell which part of the brain is involved, and that gives us an idea of like how to adjust, what to adjust, like that. So for horizontal saccades, it's the contralateral frontal lobe, ipsilateral pons, and ipsilateral cerebellum. Vertical is frontal lobe, midbrain, cerebellum. Oblique is contralateral frontal lobe, ipsilateral cerebellum. And it says high side. What that means is on the oblique part where we're looking. If we're looking up to the right, down to the left, to the right is the cerebellar side because it's up higher. And then we got pursuits, which is just taking your thumb, and they're just following your thumb back and forth. Again, different directions, focus on different parts of the brain, and they're pretty similar to one another. And then there's like light reflex, convergence, a cardinal field test that more focus on like cranial nerves themselves. But we can also, by having them do those tests, even they can improve the response for those cranial nerves as well.
Yeah. Love that, honestly. And I'm going to show you real quick. I don't know if you can see me when I talk, but horizontal is over here on the sides, like he was talking about. Can you see me when I'm doing this?
I can see you.
Yeah. Okay. Yeah. Trav can. Great. So this is the horizontal. This is vertical, above and below my head, and then oblique would be this way, crossing to the side. And he said we always look up to the brain, which is the side of the cerebellum we're testing. That's kind of what he said as a little aside there. Awesome, Trav. This is great. I mean, wow.
Yeah. And like what's cool about the eye stuff too is like, especially for cerebellum and the frontal lobe, because like the frontal lobe is responsible for motor control and things like that. If we know like which way the person's like having trouble looking, a lot of times we'll have them look that way and adjust the side at the same time to get more input to that part of the brain and kind of upregulate that more. So that's
And
where,
why is that? You know why that is, Doc?
just because we're putting the body in a better, or we're putting the input in to the body, and
Which is
now,
the adjustment.
which is the
And you're
adjustment.
also driving that muscular contraction of that same side to drive even more of that power to the brain. Yeah. Yeah. Beautiful. That's awesome. Wow. I'm in. I'm going to get chiropractic.
And then this is where we can kind of start to pick out, I guess I don't want to say like more personality
Oh,
brain,
it totally is though.
right?
It's
But it
you're
is.
yeah,
It
similar.
is because we look at the left brain and versus the right brain. The left brain, you're going to be a lot more analytical, a lot more logical, very detail oriented, where facts rule. The processing of words and language, you've got a lot better focus with, but you also have more present and past focus. So this is going to be more of the male brain, right? We learned a lot this weekend that men tend to focus more on the past. And Doc always, I think you always talk about like they always will when guys get together, they'll talk about like the one
Glory days.
play or the game that they all the guys were a part of, and they'll
Yeah.
reminisce on that. And then
Not
with
always, though. It's like a matter of aging and hormonal change. The brain changes.
yes, yep,
No, I
just
agree with you though,
more,
Sam. That's exactly right. You get a bunch of guys together, they're talking about what? The old good old days, that kind of
yep,
stuff, high school, whatever.
yep.
Yeah. But it doesn't have to be perfectly in line. This is what I want
Yeah,
to make
it's
sure.
not men are only left brain and women are
Yeah.
only
And
right
there
brain.
are definitely, it depends on, there's a
Yeah,
lot of different things that come into equation, but it's so true. And this is not our science. This is
yeah.
literally the science that's been done, research has been done. This is why we're just bringing it up because it gives us an idea to kind of target on or focus on some ideas that go along with that. So,
Yeah. And that right
yeah.
brain, you're going to be, a lot more creative and more imaginative, um, more, I'm going to say like art
Yep.
focused,
Yep.
where you have that fantasy mindset. But this is really cool because if there is left, something that we want to, like, let's take a child who, or a kid who's struggling in school, right?
Mhm.
Can't pay attention or having difficulty with certain aspects of what they're learning. Let's say English. So English would be, we would want to upregulate the left brain for them. And Travis will go in the next slide how we can do that. But we want to upregulate the left brain so they can be a little bit more attentive to what they're learning.
Yeah. And usually that's going to be right. And that's going to be somebody we can easily kind of transition them into doing some simple games or activities.
Tasks. Yep.
Yeah. Yeah. Go ahead, Trav. We'll go ahead and move that next slide then.
Yeah. So ways to upregulate the left versus right brain. So for the left brain, we kind of touched on this before, but we'll adjust on the right side of the body for the frontal cortex, parietal lobe, things like that. We could also do complex movements with the right arm or leg, have them practice like math or do math equations, smell under the left nostril, music in the right ear with a beat, talking, spin the whole body to the right with arms outstretched and thumbs together, thighs locks on the thumb, and then eye movement. So this was on Dr. Longyear's slides, but eye movements down to the left slowly. So that's more like pursuits or something like that, where we're getting some of that parietal lobe. But down to the left and then up to the right, it would be more right cerebellum. So that's where it gets a little tricky with different parts of the brain, depending on what we're focused on.
Yeah,
And then,
and I just want to hit that really quick because we'll go to the right brain in just a second. And what's really neat though, you say adjust on the right side of the body. That doesn't mean the spine, right? That literally
yeah,
means right extremities and stuff. So everything, and I want to point something out that you did a great job putting on the slide. Everything on the right side of the body goes to the left brain cortex. Everything on the left side or left side of the body goes to the right brain. However, the only thing that doesn't cross over is he was saying smell.
No.
Smell is on the same side. So it's kind of
Mhm.
interesting how all that works. Music on the right ear will help drive that left brain. So it really is neat when you can start to understand how all of these things go together and the neurology behind it to be supportive of the brain and brain development. So go ahead, Trav, and go ahead and finish up on the right
Yeah.
one.
And then the right brain, so opposite, adjust on the left side of the body, complex movements with the left arm or leg, drawing or coloring, because remember, this is our more creative side. Smell into the right nostril, spin to the opposite way with the arms straight out in front, thumbs, eyes locked on the thumbs, eye movements to the right or down to the right, and then music in the left ear or background music.
Yeah. I think that's just awesome. And it's just so neat that there's so many different things that you can be doing. And not to mention, he said adjust on the left side, still adjust the entire body and then finish on whatever side we're adjusting. That's what I love about with this total body assessment. We go through and finish on the extremities. Well, guess what that's doing? It's just fine tuning the brain and giving it a little bit more of an upregulation. So your brain's going as it walks out for about 6 to 8 days or 6 days. It's going, woo, wake up, woo, let's drive. And this is why you always feel a difference getting off the chiropractic table. So,
Yep. And so we, that's it. We really wanted to pull this back up because I can't find it, guys. I've been looking at, there we go. We really want to hit on obviously what chiropractic is in our office, and what actually happens during the adjustment. But with kind of the seminar this past weekend and, already understanding how much of the neurology comes into play with chiropractic, we really wanted to go through. I know it's a lot of information and some of that can get very confusing sometimes, but really some of the things that we're looking for in here, for patients. And we don't go super in depth when we talk to them about the neurology, but it is something that, we can and have paid attention to.
Yeah, we are doing it on a regular basis. It's just
Yeah.
really for us right now is the understanding of how important the chiropractic adjustment is and having a good doc who understands the neurology behind it to support that individual and really upregulate. Sam, stop sharing your screen then so that we can blow the.
Oh, I'm sorry.
If you just stop sharing, there you go. There, everybody's there.
Sorry about that.
I know it's okay, but and this is a great presentation, and there's so much information.
Yeah.
And honestly, we talked about the horizontal and all this other stuff that's going on. These are things that if we see something that you're not progressing in the right direction, or you're not getting better, or we need to push something more, or we have a child that needs some developmental stuff, this is where we want to be able to offer those. And you as the client to understand that there's more to this than just a therapy or just a whatever. Like everything they're doing when they're coloring, when they're playing, when they're doing stuff, it's literally they're developing this brain constantly. And those first 0 to 7 years, they're taking in all of your information. And the two culprits they're following the most are who? Mom and dad.
Mom and dad.
Yeah. So yes, you still are responsible. When they get older, they can still blame you for all those tendencies that they learned from 0 to 7. So, and they probably will. I apologize, but that's just what's going to happen. But understanding that now and knowing that now they can blame Dr. Travis or Dr. Sam if they don't hit them just right with their neurology. That you now have to take that ownership away. But guys, great job. I think we're going to do more of this kind of stuff because I think it's neat for people to know. And I think we'll even throw out some cases and stuff like that may be great, Carissa and Claire. That would be neat for them to see some of these case studies that we've changed and literally the functional change that's happening for people. So, I mean, chiropractic is something that I don't know about docs. I don't know about you guys, but I was called to. I mean, it's one of those things that I'm so glad. I can't think of anything else I'd rather be doing than being able to put my hands on somebody and help move and change their physiology just by touch and the energy that I bring to the table every time they come to get adjusted. It's literally opening my eyes to how biblical and how to understand literally what we can do to support them. So thank you guys for doing that. I'm going to open this up to questions. I mean, is there any questions, Chris? Did you have anything you want to ask, or for everybody out there that's not a chiropractor? I mean, you and Claire can ask questions if you'd like.
I mean, the question that I have might be a little silly, but I just, when I get more information about how, noticing how someone moves differently. Like, I guess my question is, so if someone comes into the office, can you just, by looking at the way that they're walking, standing, whatever, you know, kind of tell like more about them? I think the answer is yes, but like, do you guys do that? I mean, I'm like, now I'm thinking, I'm like, are they just, how do I stand? You know what I mean?
Well, what's neat, Carissa, we're not just checking out every girl that walks by, right, Claire? We're actually watching their gait, watching how they move, and understanding what's going on. But what's great about the total body assessment, Carissa, like how many times you hear people in all of our testimonials, have you been to a chiropractor before? And they say yes. Is this the same as it was when you went to the other chiropractor? And what do they say?
Nope.
Yeah, I mean, it's astounding no, right? They're like, no, this is different. It's not different because we shook them upside down or we did something wacky. It's different because we are already becoming the expert by telling them, this is what we see, this is what's happening. And when we're done, you're going to see a difference. And if you don't, then you don't need me in your life. You don't need the chiropractic adjustment. That's how confident we are with finding that stuff. And yeah, Chris, it gets to a point where you're like, wow, that person obviously has a decreased left brain or obviously has a decreased right brain. They're only doing this, they're only doing that. And we can help them so much by giving them a tweak and understanding it. So that's not a silly question. It is silly when Claire hits me in the back of the head, like, stop looking at her. And I'm like, well, I'm just checking out how she's moving. That's all.
She's not moving her left arm when she walks.
That's right.
No, that never happened. The only place where that happens is in the airport. Where
and that's true too, because we do.
Public.
Yeah, we do watch a lot of that stuff. And I mean, it's the way that we develop, right? It's the way I'm constantly learning about what's going on is I want to see what's happening and make sure that I'm sharp with my game. And it's fun. These seminars that we get to go to, guys, I'm glad you guys got a chance to go. And Carissa, you get to go at some point. It is so neat to be able to just sit back and listen to another doc who practices similar, but different in the, I guess I would say the care that he offers for the people that are coming to him. They're definitely not like, and I don't mean that this is in a bad way. Our clientele that we get, we have an awesome group of people that come in here and trust us with their health and vitality, that they're not crawling in, even though we've seen some crawl in here before. Literally,
they were lost. Those people were lost.
But literally, like, it is people that are coming in that are looking for answers to optimize performance and function and be better. Amen to that. You know, it's just awesome to be able to help those people. So anyway, what else? Anything else you guys want to add, or Claire, do you have any questions?
Not really. I loved everything y'all did and how the slides looked. They were very, I don't know,
dynamic and fancy.
Facey.
Like,
thank you, AI.
In your face.
They were beautified.
Beautifiable. That's right. Well, good. Well, listen, I'm going to let you guys go because it's already been, it's been 40 some minutes. So let's kind of wrap this up. But thank you, Carissa. We're not going to tell them what we're doing next week, but we're going to have we have our Christmas party coming up on the 11th. Everybody needs to know that. We also are heading into Christmas. Please, enjoy your family, enjoy the time off, come back rested, recovered, ready to go, ready to rock. I mean, just going into that new year, everybody's fired up about the new year. Of course, what do we do in the new year, Claire? We do our
cleanse. Get
ready for that. That's right around the corner. If you want to partake in that, please do. It's easy. It's something that you can do just to give your body a refresher, to get going in that direction, to make sure you're on the right track. I think I've hit everything. Is there anything else we need to, besides put it on a red hat and telling everybody, Merry Christmas, but from all of us, obviously. Anything else we need to go over, or are we good?
I think we're good.
Yeah. Awesome. Well, I'm going to end the recording now. Everybody hang on for just a second. I'll turn this off.